Okay, we are live.
Good morning, everyone. I am Siddhanand Mankikar. It gives me immense pleasure in welcoming all of you to today's webinar. This webinar is organized under the joint umbrella of Ontario Konkani Association, Sringeri Vidya Bharati Foundation, South Asian Diabetes Chapter, and Diabetes Canada. Since 2018, we had organized one seminar, 4 webinars, and 3 cooking demonstrations. So it is our pleasure in presenting the next one today. We will be concentrating on managing diabetes. We have 4 speakers, and the information about the speakers, especially the biodata, were shared along with the flyer. Therefore, I'm not going to take time in introducing individual speakers. However, I'll introduce the speaker by name and the title of their speech. Our first speaker, Dr. Ali Prabtani, his speech is titled Medications for Type 2 Diabetes and Prevention of Heart and Kidney Disease. Dr. Prabtani, it's all yours.
Thank you very much, Siddhanand. I wanted to thank the organizing committee for inviting me today, and I wish you all a very good morning. My talk today is on new therapies in type 2 diabetes mellitus, protecting the heart, the vascular system, and the kidneys, and with the new classes of therapies called the GLP-1 analogs and the SGLT2 inhibitors. These are my disclosures. Today, my objectives are the following. How can we further decrease the risk in type 2 diabetes mellitus with respect to kidney disease and heart disease, which are very important? I'll discuss the new therapies in type 2 diabetes mellitus, some of the side effects, and when to ask your doctor whether you should be on these therapies and what are the indications. I will start off with a case, which is a real case. This is a 55-year-old South Asian man with diabetes mellitus for 10 years. He also has a history of a heart attack in the past, some kidney disease, and high blood pressure. He's on metformin, ramipril, bedtime Lantus insulin, aspirin, and atorvastatin. His blood pressure is well controlled at 120/75. He otherwise looks well. His A1C is quite good at 6.9%. His bad cholesterol, also known as LDL, is quite good, but his urine shows a lot of protein, and his kidney function is not that great. Keep something in mind. The question for the audience is,
share your
yes.
screen. Your screen is not showing.
It is shared. Oh. Sorry, I had shared it.
Unshare and reshare. Maybe we
Okay, hold on.
went back and forth.
Oh, I'm sorry. I'm sorry about that. I'm just gonna. Can you see it now? Can you see it now?
Yes.
It's loading. It's loading.
It's loading, yeah.
Oh, so you couldn't see any
Yeah,
of my slides?
perfect. Now we can see them.
Ali, if you could kindly just start from slide 1, please.
Okay, I'll go over. Yeah, sorry about that. It seemed like my slides were shared, but anyways, I just wanted to thank the organizing committee. But this is my first slide. I've already explained that. These are my disclosures. These are my objectives. Just so I've already mentioned them, but the audience can look at them to save time. And this is the case. I'll read this case out again. So this is a 55-year-old South Asian man with type 2 diabetes mellitus for about 10 years' time. He has a history of a heart attack, kidney disease, and high blood pressure. He's on metformin, ramipril, bedtime insulin, aspirin, and atorvastatin. His blood pressure is well controlled at 120/75. He looks well otherwise. His A1C is quite good at target at 6.9%. His bad cholesterol, also known as LDL, is 1.7, but his urine shows a lot of protein, and his kidney function is borderline low. The question to the audience is, what would you do next? Keep that in mind as we go through the presentation. So there are many complications when someone has poorly controlled diabetes, and we break them down into macrovascular and microvascular. But the key problems that we really want to talk about today is how can we prevent heart disease, because that carries one of the highest risk of death and morbidity, kidney disease, stroke, and poor circulation in the legs, known as peripheral vascular or peripheral arterial disease. So these are the complications that lead to a lot of problems. And my talk today is going to be based on how can we further reduce the risk of these complications with the new therapies. So this is just a real slide showing someone's artery, which is the blood vessel that takes blood away from the heart. And you can see that in normal people, this would be very open and quite white. But here there's narrowing as a result of long-standing diabetes, which has been poorly controlled. And if this clogs even further, it can lead to a heart attack or a stroke, depending on where the blood vessel is, or poor circulation in the legs. So what are we doing at present to decrease the risk? We are doing a lot, but there's something called residual risk. So we need to do more, which is what I'm going to talk about in just a little while. So we do control our sugars, and the goal is to be having an A1C less than 7%. The blood pressure goal is to be less than 130/80. We often use drugs such as ACE inhibitors or ARBs to further control blood pressure, or even independent of blood pressure control to protect the heart and the kidneys. Smoking cessation is very important. Treating cholesterol is very important, especially with the medications called statin medications, to aim for an LDL less than 2. And in certain situations, but not all, using aspirin, but not in all. And of course, a healthy diet and healthy activity is very important. But the bottom line is, this is still not treating everything we need to treat, so we need to do more. We use many types of medications in controlling glucose or sugar in diabetes. Everyone's heard of metformin, classes known as the DP4 inhibitors, drugs like sitagliptin or Januvia, Saxenda, known as saxagliptin, and so on. And also sometimes we used to use drugs, we still do, but drugs such as diamacron or glucoside, although we're not using them as much. And those are the main drugs that we're using. And in the past, we also used to use drugs called TZDs or thiazolidinediones, but we're not using them anymore because of concerns of other side effects. So what do we have new on the block? We have two classes of drugs. The first one that I'm going to speak about are called GLP-1 agonists, or also known as GLP-1 receptor agonists. These drugs are injected. Now, GLP-1 is made by our gut, our intestines, but often there's a deficiency when you have type 2 diabetes mellitus. What does GLP-1 do? It increases insulin secretion, it decreases glucagon, and glucagon is important because it can further worsen glucose. It also decreases appetite. That's why many of these people lose weight on these therapies. And it also delays gastric emptying. What that means, it makes you get full very quickly. So you eat less, and further your glucose can improve, and you can get better A1C control. The second class that I'm going to talk about today are called the SGLT2 inhibitors. What these therapies do is they prevent glucose coming back into the blood from your kidneys, which results in further reduction in A1C and glucose, and even some weight loss, and even some blood pressure control. So these are two of the newest kids on the block. Everyone's heard of Ozempic. As many of you know, this is therapy has helped many people in diabetes, also preventing heart disease, etc. The problem right now is there's a shortage. It's not back ordered. Everyone thinks there's a back order, but there's just a shortage. There's a supply and demand issue because a lot of people are using this therapy for weight loss where it's not indicated. Ozempic is not indicated for weight loss. It's the same drug called Wegovy, same drug, but that's a different brand name. That's indicated for weight loss, which is not available in Canada. So I think we have to be very careful. Right now, the priority should be using this therapy for our diabetes patients so we don't have this shortage of Ozempic at present. And this is one of the GLP-1 analogs. So we have several GLP-1 analogs available in Canada, and the list is on the left. Ozempic is the one that's most commonly used because it's available by drug formulary. It's given once a week by injection. There's also Rybelsus, which is the oral formulation of Ozempic, and the drug actually is called semaglutide. Wegovy is also semaglutide, but that's a higher dose used for weight loss. We have Trulicity, which is dulaglutide, Victoza, which is once a day. Saxenda is also liraglutide, used for weight loss. Then we have a few others, exenatide, also known as Byetta, and Bydureon. And lastly, the newest GLP-1 analog, which is a combined GLP-1 and a GIP, is Mounjaro, just recently released in Canada, called tirzepatide, indicated for diabetes patients. It just got available in Canada recently. But the bottom line is, what do these drugs do, the GLP-1 analogs? They significantly improve A1C and glucose control. They have a huge effect on weight loss. But in the red, what the biggest news and the most important news is, regardless of glucose control, regardless of A1C, they also benefit the heart and the brain in terms of reduction in vascular complications. There's also some data that it may also decrease dementia. Now, does everyone benefit from the heart and the brain and the circulation point of view? Most do, especially the higher the risk, in terms of the vascular risk, the more likely you're going to benefit. So if you have multiple risk factors in diabetes, or you've already had an event, either a heart attack or a stroke or poor circulation, you're going to benefit even more, regardless of the A1C. So keep that in mind. So this is just a picture of some evidence showing what these drugs have done. They decrease the risk of heart attack, cardiovascular death, and even stroke. So overall, they improve all cardiovascular outcomes. The higher the risk, the more the benefit you're going to get. So these are wonder drugs applied in the right patient. With any drug, as you know, there can be some side effects. The most common side effects are GI or gastrointestinal side effects related to the stomach or the bowel. But the good news is if you start slowly and go slowly, many of these side effects can be minimized. The key thing is the healthcare provider has to educate the patient with regards to the nausea, the diarrhea, and constipation. So what can you do? It's important to chew slowly. Some people find that probiotics are helpful. I've already mentioned to have small, frequent meals in the past. That's very important. And avoiding strong smells and to stay hydrated. The other important thing is to avoid very, very, very high fiber foods. Fiber is important, but we have to keep that in moderation also. So these are all important things. For the constipation point of view, hydration is very important, and eating a healthy, balanced diet. So what the most important thing is to go slowly with the dose, chew slowly. Even sometimes ginger can help. And if you take all these things and do it slowly, most people may get minor side effects, but it goes away with time. The added benefit, as I mentioned, is weight loss, and there is no hypoglycemia with these therapies on its own. Of course, if they're combined with insulin, then there is a risk of hypoglycemia, but it's often not that significant, especially with counseling. So again, I just wanted to be redundant and tell you who benefits from these patients is those high-risk patients with diabetes, especially if they're overweight and have a high vascular risk. People can drop their A1C by roughly 1.5 to 2% with these medications. Some people can lose about 5% of weight, and even the blood pressure reduction is there. And they're injectable. Ozempic or semaglutide is injected once a week, which makes it very, very convenient. So when should we use these therapies? Just to summarize, if someone already has heart disease, that's an important time to use these therapies. I'm sorry, you know what? I just wanted to, there's a typo on that slide. I apologize. Apologize for that. The next therapy that I wanted to talk about here, I'm just going to maximize that, are the SGLT2 inhibitors. So we've already talked about the GLP-1 analogs. I'm going to go on to the next class, which are the SGLT2 inhibitors. We have several SGLT2 inhibitors available in Canada. The three broad ones are dapagliflozin, canagliflozin, and empagliflozin. By their brand name, they're known as Forxiga, Invokana, and Jardiance. These ones are oral, taken once daily or even twice daily if they're in combination pills, often with metformin. So it makes it very easy from the convenience point of view. What do these therapies do? They improve A1C and glucose. They have weight loss properties, and they also don't cause hypoglycemia. Again, with any therapies, as I mentioned, there's also side effects, although the side effects here are quite minor. Sometimes if their patients aren't hydrated well, it can lead to dehydration. Often this is not an issue as long as they're hydrated well. The biggest concern, especially in women, is genital infections, but this can be easily prevented by good hygiene in the genital area. And if it happens, there's very safe antifungal or anti-genital type therapies that can treat the infection. There's a rare condition called euglycemic ketoacidosis that can occur with these therapies in type 2 diabetes mellitus, where their sugar is normal, but they can have a condition called ketoacidosis where they have nausea, vomiting, significant abdominal pain. And if this ever happens, you go to the hospital right away. Often it's in the setting of a precipitant, such as an infection or an operation or not having an adequate diet. So again, very rare, but it's something to be aware of. The bone fracture issue is a very, very, very rare thing. I just wanted to mention that. People who have type 1 diabetes should not take these therapies. Also, if you're pregnant, these therapies should not be taken. That is the SGLT2 inhibitors. They're contraindicated. So when should we be using these therapies? And I'll summarize. Someone with high risk, independent of glucose control. So someone who has diabetes, but also has heart disease to begin with, or cardiovascular disease, will benefit from the SGLT2 inhibitors. There's also an indication now, regardless whether they have diabetes or not, in heart failure. They prevent hospitalization and other good cardiac outcomes if they have heart failure to use these therapies. And the last one, the third one, besides glucose control, heart failure, is someone with kidney disease, whether they have diabetes or not, they should be on these therapies to prevent dialysis or the worsening of their kidney function. Once again, I've summarized the uses on the right, and they also have a minor effect on weight loss also, but not as significant. So what are the benefits of the SGLT2 inhibitors in summary? Someone who has type 2 diabetes mellitus, number one. Number two, someone who has diabetes and cardiovascular disease. And if they have heart failure, it doesn't matter if they have diabetes or not. These patients will still benefit. And lastly, patients with kidney disease, regardless of having diabetes or not, they'll benefit because there'll be a decreased need for dialysis and prevention of worsening of kidney failure. And just to reiterate, these effects often are independent of what their glucose control is. So these drugs go beyond glucose control. Don't forget, even though I've talked about these two fascinating therapies, the GLP-1 analogs and SGLT2 inhibitors, we can't forget the usual things. You still need to maintain good glycemic control or good A1C reduction and glucose control. Our blood pressure should be targeted to less than 130/80 if you have diabetes. It's really important to make sure the LDL, the bad cholesterol, is less than 2.0, especially by using a therapy known as statins. Number four, these are the ABCDs of diabetes, by the way. Most patients should probably be on some kind of therapy to protect their kidneys and their heart, such as ACE inhibitors or ARBs. And I've already stressed the importance of GLP-1 analogs or SGLT2 inhibitors in the right patient population with diabetes. Of course, lifestyle is important, including healthy exercise and healthy activity. And what's often forgotten, which is very important, is you can do all these things, but if you continue to smoke, your risk of heart disease and other things is much higher. So smoking cessation is very, very important. Why should we do all this? You're going to feel better and have a better quality of life. You're going to decrease your risk of heart disease and kidney disease and stroke. I've already talked about the therapies. Decrease eye disease, which is another complication. I've already talked about kidney disease. Also decreasing amputations, because if you have poor circulation and you can't feel things in your feet, there's a higher risk of amputations. And of course, decrease hospital admissions. And lastly, decrease early death. So I'm going to go back to this case, something to think about. So the same patient that I talked about, 55-year-old South Asian man with type 2 diabetes mellitus for 10 years time. He also has a history of a heart attack, kidney disease, and high blood pressure. He's on all the right therapies right now, but maybe missing a few. His blood pressure is 120/75. Otherwise, it looks well. His A1C is well controlled. LDL is 1.7. His urine shows protein in the urine, and his kidney function is not that great. So this is a perfect example of a patient who should be at least on one of the agents, GLP-1 analog or an SGLT2 inhibitor, or probably both, to protect his heart further and his kidney further. So again, this patient is missing these essential therapies to further protect his overall health. The summary slide. So when we think about diabetes, we need to go beyond just thinking about glucose and A1C. We need to think about the heart and the kidneys and the brain, etc. We have to think about these new therapies, which can further reduce the risk in terms of heart disease, stroke, and kidney disease. They're all safe and effective for the most part, as long as you have adequate counseling. But also at the same time, don't forget the usual things like glucose control, blood pressure, cholesterol, smoking, etc. Remember, you are in control of your diabetes. An important quote, which is anonymous, is take a little time to do it right now, or take a lot of time to do it later, which is very, very important. Just a couple of quotes that I wanted to leave the audience with. Education is the most powerful weapon which you can use to change the world, Nelson Mandela. And an investment in knowledge pays the best interest, Benjamin Franklin. This is just a website for Diabetes Canada, where you'll find lots of information, which is based often in a culturally sensitive manner. Thank you very much.
Thank you, Dr. Prabdhani. Excellent presentation, lots of information. Really appreciate it. The next presentation is by Shabnam Jabrani and Fatima Punjani. Both are registered dietitians and certified diabetic educators. Their the speech title is Popular Diets and Challenges. Up to you, Fatima.
Thank you. Good morning, everybody. I hope you can see my screen. I think I have to. Sorry, I'm just making it presentation mode. Yeah, hopefully you can see my screen. So I'm Fatima, I'm one of the dietitians. I'm going to present to you a little bit about plant-based diets. So there are a number of diets out there, and there's always the question of, should I use it? Should I not use it? What are the benefits? What are the side effects? And so I'm going to start with just one of the diets, and then Shabnam is going to take over with a few others. Remember always in your mind that everything is not right for everybody. There might be certain things that might be right for me, but not right for you, not appropriate for you. So it's an individualized thing. So overall, what is a plant-based diet? So a plant-based diet can come in various forms. It could be a strict plant-based diet, like a strict vegan diet, which excludes all animal origin food products. It could be a flexitarian diet, where some people tend to have meat and meat products or chicken or fish outside the house, but not in their house. There is one form where people will eat fish and seafood. It's called pescatarian vegetarian diet. And then the most popular form of this is the ovo-lacto-vegetarian, where people will have no meat, but they will consume dairy and eggs. So milk, yogurt, cheese, and eggs. A question that comes to mind is, would a plant-based diet be nutritionally adequate? Would it provide me with what I need? So the aim of a healthy plant-based diet is always to provide you with adequate nutrition to meet your needs. It focuses on nutrient-dense foods based on plant origin, rather than calorie-dense foods. Excuse me. It aims to minimize processed foods, reduce oil and animal products in the diet. And in this way, it encourages us to use more vegetables, fruits, beans, pulses, lentils, etc. And these are lower in saturated fat, in different kinds of fat. And that's why they help us in maintaining a healthy diet. The American Diabetes Association and Diabetes Canada have a joint position statement on plant-based diets. And I quote, "An appropriately planned plant-based diet is healthy, nutritionally adequate, and it provides health benefits in the prevention and treatment of certain diseases." So it goes beyond just diabetes. It goes and it helps with certain different types of diseases. So what does a plant-based diet include? It includes vegetables, cooked or raw. It includes fresh fruits. It includes lentils, preferably lentils and dals which have the skin on it, legumes and beans such as soya beans, edamame, navy beans, chickpeas, black chana. It includes whole grain products, whole wheat products, so things like quinoa, things like bread made out of whole grain or multigrain, pasta made out of whole wheat or lentil-based pasta, cereals that are made from whole grains. It limits or avoids, like we talked about processing, so refined grains and white flour, they would come under processed products. So it tends to limit or avoid having those things. Nuts and seeds in small quantities. And then depending on whether you are a strict vegetarian or you have some flexibility, you would either include dairy and eggs, but again, on the lower fat side. So low fat, 1% or skim milk, fat-free yogurt, low-fat cheese, those kind of options. Talking specifically about diabetes, how does a plant-based diet reduce the risk of diabetes? Is when you are consuming carbohydrate, which are which have the husk in it. So using grains in its original form rather than refined carbohydrates. So using the whole grain of wheat to make it into whole wheat flour rather than removing the husk and the fiber part of the grains of the wheat and then processing it into flour. So that would be white flour. So avoiding the refined carbohydrates, the processed carbohydrates, avoiding sugary drinks, also avoiding saturated fat, which come from animal sources, processed meats, which have a lot of nitrites and other chemicals in it. All this put together reduces our risk of type 2 diabetes. So we are taking more higher fiber options, which helps to reduce the risk of diabetes. And then we're avoiding the refined carbohydrates. So that balance really helps improve our or prevent the risk of diabetes. Or if you have diabetes, it helps in controlling and managing diabetes much better. On the other hand, plant-based diets are more nutrient dense rather than calorie dense. So lower calorie diets, that has a protective effect. So if you look at numbers, people who are vegetarian, they have a 1.6 to 2 times lower risk of developing diabetes than their counterparts who eat meat as well. Putting it into simple terms, a plant-based diet, because it has more fiber, that leads to a better or an improved sensitivity of insulin. So your insulin is working more effectively and efficiently. Because you replace the saturated fat or reduce the saturated fat because you're limiting your animal sources of food. You also take some fat from vegetable sources, which is unsaturated. This helps in decreasing insulin resistance. It also has other benefits. I'll discuss that in the next slide. But overall, with a less amount of fat in our diet, we lose weight because it's lower in calories. We lose fat from the abdominal area, which is called visceral fat, which is actually the biggest cause of insulin resistance and diabetes. So overall, a plant-based diet helps in reducing the risk of diabetes, developing diabetes. The other benefits of plant-based diets, the other biggest one, and like Dr. Praptani also talked about, cardiovascular health, right? So it's a big thing in addition to your diabetes health, because diabetes, cardiovascular health, high blood pressure, kind of all go hand in hand, and each exacerbates the other, worsens the other. So a risk reduction in the other areas, in cardiovascular health and blood pressure, it makes a big difference in your risk for diabetes and in managing diabetes as well. So overall, a plant-based diet will reduce your lousy cholesterol or your LDL, your bad cholesterol. It will improve your blood pressure. It will take the pressure off your heart, and it will reduce the risk of ischemic heart disease. In terms of numbers, when people are on plant-based diets, with the plant-based diets, they're associated with 20% reduction in the incidence of coronary artery disease. So first event of coronary artery disease, and then 22% drop in mortality or dying from coronary artery diseases. So those are big numbers if you see in terms of risk reduction. In addition to that, when you're consuming plant-based diets, you have a lot of different colors of fruits and vegetables in your diet. These colors actually represent the different antioxidants. So vitamin C, vitamin E, those antioxidants that we are so fond of taking in pill form, they are present naturally in the plant-based diet and in large amounts. Body absorbs what it needs, it leaves what it doesn't need. So it absorbs just as much as it requires. Antioxidants help reduce inflammation. So they will help with, things like fibromyalgia as well, rheumatoid arthritis as well, things that go with autoimmune stuff as well. The fiber part of the plant-based diet helps improve our gut health. So increased fiber will lead to less absorption of fat. It will lead to decreased inflammation. It will help improve our gut flora, which helps keep our digestive system healthy. It improves the quality of life, sleep, anxiety. It reduces anxiety and depression. So overall, plant-based diet does have a lot of benefits, and it can meet our needs very easily. A few things that we do need to consider if we are a complete vegetarian or vegan: it lacks some of the nutrients which we can adapt very easily and get from other sources. So things like iron. Iron is a little bit low in plant-based stuff, and the absorption is not the greatest. But combining a food source of vitamin C with iron helps to improve the absorption. If you are low in iron and zinc, the doctor can supplement through a supplement, but then it's important to make sure you go to your family doctors on a regular basis and check your blood work. So then if any deficiency is arising, they will be able to catch it and remedy it quickly. Vitamin B12 is the biggest issue that we have with plant-based diets. We don't have vitamin B12 in a plant origin form. So that has to be taken as a supplement in a pill form for sure, either a pill or an injectable. Your doctor will decide based on lab work that they can do. Vitamin D is a big thing for Canadians across the board, whether you are plant-based eater or whether you're a carnivorous eater. Vitamin D is very low in our diet, especially with the weather over here. So that supplementation is something that we all need to do, especially in the winter months. Calcium can be low, especially if you are a vegan where you're not taking any dairy. If you're taking dairy, then not an issue. But if you're not taking dairy, then calcium is something we need to monitor and see how we can get an alternate source of calcium. So it could be kefir, it could be oat milk, which is supplemented with calcium. It could be rice-based milk. It could be various different plant-based milks are available, almond milk, soya milk. They are all supplemented with calcium. However, we just need to make sure that they are not supplemented. They don't have added sugar. So some of the flavored ones have added sugar. We need to be a little mindful of that. Because omega-3, which is one of the good fats that we need, is also an animal-based product. Plant-based eaters will be a little bit lower on that, but flaxseed is a good substitute to get that from a plant-based diet. Plant-based diet do tend to be a little bit lower in protein, and that is a balance we have to see individually how people are doing. And that's more of an individual talk, but they're lower in saturated fat and cholesterol, because saturated fat and cholesterol we get from animal sources and not from plant sources. So a few issues to be kept in mind when you're eating a plant-based diet. Some of the practical challenges. So yes, the plant-based diet is a really good diet. It helps because it has a higher content of fat. It has, a higher content of fiber from the whole grains that we are eating. But then some of the practical challenges we face as South Asians especially is we don't prefer the whole wheat flour. We prefer the white flour. We prefer making things out of rice flour, which has no fiber in it. So we kind of use things which don't actually technically fit into a plant-based diet. Rather than using white flour, we should be using whole wheat flour. We should be using grains such as quinoa and bulgur and barley. They are much better grains. They have more fiber, but we tend to gravitate more towards the lower fiber end of the plant-based diet. So rice-based things are very common. White flour, white wheat flour things, parathas and stuff like that, they're very common in our diet that tend to have lower amount of fiber in them. The other piece that a challenge that we face with the plant-based diet is, although the plant-based diet is lower in calories, lower in saturated fat, when we cook our food products, we add a lot of fat to it. So we are very used to having our samosas and kebabs and, deep fried vadas and stuff like that. So that adds a lot of fat to our diet. Things like adding tadka on the dal, tadka on various products, things like roti versus parathas. The parathas have a lot of fat in them. So we add a lot of fat in our diet, which originally a plant-based diet does not have. So we have to be mindful of the changes that we are making or the cooking processes that we are using that increase the amount of calories and fat and saturated fat. And even worse, the parathas, the banaspati ghee that we use, it's not just saturated fat, it's trans fat. Trans fat is even worse. It increases your risk of heart attacks and heart diseases, coronary artery diseases. So we have to be very mindful of what we are doing. So quickly, just some do's and don'ts. Good to have raw vegetables, steam them, roast them, boil them, but don't fry them because that adds more fat to them. Most foods contain natural salt in them, so avoiding table salt, avoiding adding salt on top. Eat the fruit fresh rather than making it into smoothie. So if you remember, the first slide had processed foods, avoid processed foods. So even when you are putting the foods through the blender to make it into smoothies, that's processing. That's part of the work of the stomach. Try and reduce those. It's not that it's bad, but it's just you're doing some of the work of the stomach. It's better to eat the fruit. Avoid the juices completely. Then avoid toppings such as butter, sour cream, mayo. They are packed in calories. So we want to kind of avoid them and have the food product in its original form so that we're not adding more calories to the food product. Things like beans, legumes, etc. If you're making them fresh at home, you are in control of the amount of salt that you're adding. But canned products, canned beans, etc., high in salt. So another, salt will lead to high blood pressure. Things like nuts and seeds, small portions, like a small handful, like about 15 nuts kind of thing for one day, and unsalted. You're adding salt if you're using the roasted and salted nuts and seeds. Roasting is fine, but salted is not. When you're looking at dairy, look at 1% and skim milk, not whole milk or 2% milk. They're very high in fat. So in conclusion, pulling it all together, a plant-based diet is a healthy diet. Make sure you plan what you're eating. Make sure you read labels to look at the amount of fat, the amount of fiber in it. You want more fiber, less fat, and you have to be disciplined. I think planning is the key here. If you plan what you're going to buy, then it helps avoiding problems when you're in the supermarket. The recommendations for patients who want to follow a plant-based diet may include eating a variety of fruits and vegetables, beans, legumes, seeds, nuts, and whole grains, and avoiding or limiting animal products, avoiding added fats and oils, and refined products or processed carbohydrates. The major benefits for patients who decide to start plant-based diets are the possibility of reduction in a number of medication that they may take to treat a variety of chronic conditions. It lowers body weight, it decreases the risk of cancer, and a reduction in the risk of diseases or deaths from ischemic heart diseases. So that's a whole bunch of things that does give us benefit. Last slide, just overall looking at your plate. You've probably seen the healthy plate before. So again, half of the plate should be vegetables as much as possible. I usually recommend a combination of cooked and raw vegetables because they give us different benefits, different nutrients. Quarter plate of grains, also again from whole grains, not processed grains, not refined flours. A quarter plate from protein. It could be edamame, it could be yogurt. Greek yogurt is a good choice for people who take dairy, nuts and seeds and legumes, etc. But then just remembering that calcium components, so have a yogurt or milk, which is maybe plant-based, but it is fortified with calcium. Make sure it's plain, it's not flavored. Flavored ones are high in sugar. Then looking at vitamin B12 and D supplementation. That kind of gives you a good balanced nutrient intake. Thank you.
Shabnam, you are going to take over.
Go ahead, Santanaji. Introduce your topic, her name and her topic.
Yeah, Shabnam Jabrani, the same topic, popular diets and challenges, practical challenges. Shabnam?
Hello, everyone. I'm Shabnam Jabrani, registered dietitian and certified diabetes educator. I work at a family health team, and my topic is going to talk about intermittent fasting and keto diets. So Fatima has covered vegetarian, but I'm going to talk about a different topic. So let us understand what is intermittent fasting. So basically, it is a time restricted eating pattern. So it's not a diet, but it is a tool for weight loss that causes people to eat less because they have a shorter eating window. So this way, it's allowing your body to get energy from the body stores. So there are different kinds of fasting patterns. One of them being ADF, which is alternate day fasting, where people eat one day and the next day they abstain from eating any calorie containing foods or beverages every other day. Then there can be a modified ADF where people consume 20 to 25% of the normal caloric intake on the fasting day as well. There can be time restricted feeding window. It ranges from 4 to 12 hours and fasting from 12 to 8 p.m. 12 to 20 hours. Early time restricted feeding is also being practiced by some people where they eat from 6 a.m. to 12 noon or from 8 a.m. to 2 p.m. Some people practice 5:2 periodic or cycling fast, where they have 5 days of normal eating or 2 days of fasting. Some people use 6:1, where they are eating for 6 days and then fasting for 1 day. So there are fasting variations, and sometimes the classic fast is one of them, where people drink only water, and flavor may be added to the water, like some fruit slices, any citrus fruits, apple cider vinegar, etc. But they drink only water all throughout the day. Then there is something called dry fasting, where no water is also consumed, but this is not recommended if you are going to exceed over 24 hours, it's not recommended. So what happens in dry fasting is that because you haven't eaten, your insulin level that your body produces, it goes down. So the fat stores are metabolized. And when they are metabolized, they give out water, and that can cause diarrhea. And some people have to frequently pass urine. With dry fasting, hunger is less with dry fasting than with water fast. Some people do tea fast, and herbal teas without any cream or sweeteners is allowed. And since you're not consuming any calories, so it does not have an effect on the insulin. People also can do a black coffee fast where a little bit of cream may be added. Bone broth can be consumed if you're fasting, and that can consist of bones, vegetables, herbs, and vinegar. This can give you some protein, fats, and some calories. And because it's in small quantities, these nutrients do help. And it's also good for suppressing hunger because you're drinking something which you may enjoy. Then fat fasting, it also helps to suppress hunger and satiating because people take coffee and they add some butter to it. So that is called fat fasting, and it's called bulletproof coffee. Then some people can also do, like, as I said earlier, 5 normal days of eating and 2 days of low calorie intake. And there's something called the fiber fast where you can have chia seeds. So these are the different variations of fasting which people can utilize. So how does fasting work? So because you're not eating, your insulin levels fall. So remember, insulin is a storage hormone. It increases the synthesis of glycogen and body fat, and it also stops the breakdown of glycogen and body fat. So essentially, it is helping you to store your body fat. So when you don't eat, your body does not release insulin to kind of do these processes. Plus, the counter-regulatory hormones will rise, and that will allow your body to take the food, energy, or calories out of storage. That is from glycogen and fat to use for metabolism, for burning to give you energy. So basically what we are looking at here is that, remember that previously we used to always focus on calories, and we considered that, oh, if I restrict my diet and eat less calories, I'm going to be losing weight, because we all focused on the balance of calorie in and calorie out. But not all calories are the same. So for example, if you restrict, say, 100 calories, so you are getting 100 calories, say, from eating broccoli versus 100 calories from eating a cookie. So it doesn't mean that that is going to have the same response in your body, because when you eat a cookie, it's going to stimulate insulin release. Whereas when you eat broccoli, that's not going to happen. So in weight management or management of the body stores in your body, the kind of response that food has on your hormones is equally important. So please don't focus only on calories and ignore the hormones. Likewise, don't focus on hormones only and ignore the calories. What I mean by this is, some people, they fast and they think that, and that is good because it is stopping your insulin production. But at the same time, after breaking the fast, if you're going to overfeed yourself, then that's not a good strategy for weight loss, because whatever benefits you got from fasting, you're going to nullify it by overeating. So time-restricted eating does have some benefits, because it gives a structure to your eating routine. So you decide that, okay, I'm going to do a 16:8 hour fast. So I'm going to fast for 16 hours and then eat only for 8 hours. So that way it gives you a structure. You are not focusing on calories, but you're focusing on the hours, and you're counting hours of the day instead of calories. It helps you to build some dietary consistency, which helps to form habits which do not require a lot of work, and so it gives you more success. And it's very convenient and flexible because you can decide whether what day you want to fast or for how many hours you want to fast. You can change the routine. So it's basically quite flexible and it's free. You don't have to like spend any thing for fasting. It's not a diet, remember, it's just a tool which can help you, and it can work with any diet, whether you go for a keto diet or a plant-based vegan diet. Sorry. So it can work with any diet as such. It offers you unlimited power because you can increase the duration or frequency of fasting, as it is allowing your body to use up the energy it has stored. Now, some of the challenges of intermittent fasting are headaches and dizziness. So that probably happens because of dehydration. So taking some salt can be helpful. Some people experience constipation, so laxatives can help. Other people may experience diarrhea, so bulking agents like psyllium fiber would be useful. It can also cause a change in your blood glucose and energy levels, because your blood glucose will drop and your energy levels may, you may also feel low energy levels. And there can also be intense hunger, which can cause our cortisol levels to rise, and that can slow down the melatonin production that is needed to make you fall asleep. So intermittent fasting can also cause insomnia as a result. So some of the fasting mistakes that people make are that be mindful of your triggers. For some people, the smell of food or watching commercial on TV with, all those food ads that we see, or you're passing through a mall where, you're going to the food court, or your stress, all those things, the availability of food at home, all those things can be a trigger and make you give into temptation and break your fast. Another mistake, as I said earlier, like if you're going to overeat, then that is also a big mistake because it nullifies the benefits of the fast. And sometimes for some people, having a buddy to fast with them is really useful. And we can see that in some cultures, they do fasting for religious reason and the whole family is fasting. So there's a lot of support and benefits to doing it with someone else. Next, I'm going to talk about the keto diets. So basically, when in times of famine, it has been seen that our body adapts to burning ketones, breaking down fat, and using the ketones to give us, to help us survive. And so this strategy is being used by a lot of people for weight loss. And be aware that to achieve ketosis, it can take up to 72 hours. So a keto diet usually consists of about 20 to 50 grams of carbohydrate, which contributes less than 5% to your total caloric intake. 75% of your calories come from fat and 20% from proteins. Mostly foods to be eaten will include fatty fish, eggs, dairy, meat, butter, oils, nuts, seeds, and low-carb vegetables. And that some people also use fat bombs like unsweetened chocolate or coconut oil that can help them reach their daily goals for fat intake. Because if you think about 75% fat, that's a lot of fat you're supposed to be taking to put your body into ketosis. So let's look at whether a keto diet is healthy and safe. It helps in weight loss and lowering blood glucose, but it is not sustainable. Like how many people would like to eat no carbs at all or very little carbs and eat a high-fat, meat-based diet so that, they can continue to lose weight. So it's not a sustainable diet. Also, it has been seen, like if you remember the Biggest Loser competition, which was shown on TV, the weight comes back, and sometimes it's more than what you have lost. Because it's a very restrictive eating pattern, there are missing food groups. So you're lacking in some vegetables and proteins, and therefore you may end up with nutrient deficiencies. It's very costly because you're always having to eat animal sources of protein, so that can be expensive. If you have diabetes and you want to go on a keto diet, then you have to be very careful and discuss with your provider, because some of your medications would need to be adjusted to avoid possibilities of low or ketoacidosis, like Dr. Preptani mentioned, with SGLT2 inhibitors. Keto diets can cause your blood pressure to drop. It can cause kidney stones, constipation, and nutrient deficiencies, as well as increase the risk of heart disease. People also experience the keto flu, which has symptoms like upset stomach, dizziness, mood swings, and decreased energy levels. So remember, there's not one diet which is good for everyone. There are many different approaches. Select the one which is best for you, which is sustainable for you, for which you may discuss with your diabetes educator team and come up with a good plan and strategy for yourself. Thank you very much for this opportunity, and please feel free to put in your questions in the chat window.
Thank you, Shabnam and Fatima. Excellent presentation. Absolutely very interesting information, especially diet being major tool to manage diabetes. And especially considering that since we had a seminar by Dr. Jagannath Dixit, there were lots of questions on intermittent fasting. And the presentation you gave, Shabnam, is excellent. It covers a lot of questions that even I had. Thank you very much. And once again, before I introduce our next speaker, please, as Shabnam mentioned, if you have any questions, please post them on the chat. We will try our best to answer as many questions as possible during question and answer session. The next presentation is by Suki Kaur. She'll be talking about Empower Your Health and how to manage between the appointments. Suki, it's all yours.
Thank you, Sadan. Good morning, everybody. My name is Suki Kaur. I'm one of the nurses, and I'm a nurse educator, and I'm very grateful for this opportunity to be able to present some. My excellent and wonderful colleagues have already done a great job, so I'll try to keep it nice and simple. I just want to make sure, can everybody see my screen?
Yes.
Thank you, Sadan. So, like I said, we're going to be talking about empowering your health, and we're going to talk about how you could prepare for a doctor's appointment. I want to start off by just, mentioning about an endocrinologist. You may or may not have heard about, this subspecialty of doctors. Dr. Ali Preptani is one of the endocrinologists I work with, and it's an honor to work with him. So endocrinologists typically provide care for people with diabetes, along with other endocrine-related issues as well. They can certainly be very, very helpful in managing and controlling symptoms of diabetes. As we talk about seeing a specialist, the goal of our presentation today would be to make sure that you know what to bring to an appointment and how to prepare for that appointment. So one of the important things is getting an appointment first, but once you have an appointment, there's usually several questions around the appointment, including some nervousness and anxiety. So some things that you should do before the appointment is make sure you have a list of medications. Now, this could be a list that you've written down. Majority of our patients will either bring their pill bottles with them, which sometimes can be a high number of pill bottles. And some individuals, what they do is they get a printout from their pharmacy. And that printout talks about all the latest medications they have. A lot of our patients have also, what they do is they keep this list of medications in their wallets. But what we usually request individuals is to make sure that it's an up-to-date list that they may get from their pharmacy, or they can just bring it like a handwritten one as well. Also, the second thing that I want to make sure that everybody does is bring all your questions. Now, if you're like me, who can remember a few things for a couple of hours, it's great. But generally what we recommend is to either have a list of questions written down or in your phone, so that when you're in an appointment with your doctor, you can get all of those questions answered and make sure that you don't forget. Make sure you get all your blood work done at least 2 weeks before the appointment. And we usually say 2 to 3 weeks, so that, you know, your doctor has had enough time to get the reports back from the lab as well. Make sure you bring your blood glucose meter, at least your blood sugar data. So a lot of ways people do that now. And we'll talk about in our upcoming slides is, you know, they can either bring their glucometer to the appointment, or they can handwrite those as well. Last but not least is make sure you write down all the dates for your appointments with your specialists, such as your eye doctor, your foot doctor, your cardiologist, etc. So when you come in to see an endocrinologist as part of their routine checkup, they will ask you when was the last time you saw an eye doctor and other specialists. So make sure you have that information handy as well. So like I had said about recording your blood sugar data. So one of the important things would be to come to an appointment well prepared, to at least have your blood sugars written down. So traditional way of doing that was you might be getting those notebooks or a sheet of paper where you were recording your logbook, your blood sugar data. You could do that. And the other thing to supplement that would be to bring in your glucometer. With the data and technology now, there's a lot of meters, for instance, a Freestyle Libre, which basically is used to scan your blood sugars. And what you do with that is, you can either upload all of that information at home, or you can just bring that device itself, or you could just, if you have a smartphone and you could put that in an app and you're using that app, you can just bring that device with you as well. So when we talk about blood sugars, we always talk about HbA1c. You might have heard that from your family doctor, from a friend, you know, from a specialist, from any healthcare provider, such as pharmacist, etc. They talk about the 3-month average. So the 3-month average is called an HbA1c. And it is basically a 3-month average of your blood sugars. So whatever your blood sugars were for the last 3 months, it takes up all the average of that and gives you a certain number. And that number is usually in a percentage. So for normal individuals without diabetes, their A1C is usually below 6%. For individuals that are at risk for diabetes or pre-diabetes, that number is usually between 6 to 6.4%. And anybody whose A1C is at 6.5% or higher is considered a diabetic. So when we talk about checking your blood sugars on a daily basis, we want to know what the targets are. And you may or may not have heard about these targets, but for individuals that have diabetes, we're aiming for their fasting blood sugars or before meals blood sugars to be between 4 to 7. And for after meals, we generally aim for checking them 2 hours after meals, and that number should be between 5 to 10. I want to just show you for comparison for individuals without diabetes, if you're ever asked to check your blood sugars, your fasting readings should be between 4 to 5.9, and 2 hours after meals are usually less than 7.8. The other important thing that I want to focus on is blood pressure. So anytime you go see a healthcare provider, one of the first things you would likely do is get your blood pressure checked. And from my family members, I know whenever they go see a doctor, they're very nervous about getting their blood pressure checked. And they sometimes in the nervousness also forget to ask the doctor what the reading was. So make sure you know what your blood sugar reading was at that visit, just for your own knowledge as well and for your own information. The ideal blood pressure measurement is usually 120/80. With that being said, because we're all different people, we're all of different body types, sizes, and heights, etc., that ideal reading could be different for you. For someone, it could be 110/70. For someone, the norm could be 130/90. But that's something that you can talk to your provider about as to what the blood pressure reading is that you should aim for. But for normal average individuals, 120/80 with a ±10 is what we aim for. So how often should you see your doctor? So your family doctor is usually as needed. And then your family doctors would also probably bring you back in every 3 months for a diabetes checkup. But if you have diabetes and you also see a specialist, such as, one of our endocrinologists, depending on your blood sugar control, depending on your endocrinologist, your appointments could be either every 3 months or could be between 6 months to 9 months. So usually between 3 to 12 months and sometimes up to 18 months. For instance, in our clinic, in Hamilton, we have a very big complement of teams. So we've got endocrinologists, we've got nurses, our dietitians, and what we do is, because our endocrinologists have a very big roster, they will end up seeing our patients every year to year and a half, but then we supplement that appointments by seeing a nurse and a dietitian every 3 to 6 months. So have that conversation. Ask your doctors as to how often would you be seeing them. Ask them if there's other healthcare professionals that are available to help and support you as well. My big thing always, and what we always educate our patients on, is always ask questions. Ask questions about, what your current blood work was and what are the readings? How are they different from the last time? What was your A1C? Where does it fall on the, on the algorithm? What are medications? If they're asking and talking about new medications, ask them. Ask about, your blood pressure reading, and ask about any other questions that you may have, because at the end of the day, you don't want to go back and then wait another 3 months to a year to be asking those questions. My references, I got all the information from the Canadian Diabetes Association. And that's it for me. Thank you.
Thank you, Suki. That was an excellent presentation. Really enjoyed that. Now I know what to do before I go to the doctor. I will remember everything you have said. Thank you very much.
Thank you. Thank you.
Okay, at this point, what we are going to do is have a 10-minute break. But one very important thing I wanted to mention is after the break, when we come in, we are going to have some fun. There will be some trivia questions, 3 questions. And first 3 people who answer correctly will get a special gift, and we will explain it once we come back. So just relax, and using the same link that you had used to enter this event, please join us in 10 minutes. Thank you very much.
And when we come back from the break, we'll be also doing a question and answer after the trivia. So have your questions typed on the chat, and we look forward to seeing you after the break.
Absolutely. Thank you, Shiva, for reminding that. So relax and enjoy. Well, welcome back. I hope you all had a good stretch break. We are into the second part of our event today. As we had publicized, as well as I had mentioned earlier, we are going to have a little bit of a fun before we get into the QA session. This event will include 3 questions, 1 question at a time. And the first 3 people who answer correctly will get a $10 coupon from Shoppers Drug Mart. I will hand it over to Rachana to start with the first question. Maybe we can wait for a couple of minutes because most of the people have rejoined. If we give 2 minutes, hopefully others will join. Rachana, it's yours.
Thank you, Sadanand ma'am. Am I audible?
Slightly louder would be better.
Am I audible now?
Seems like
Yes.
that, yeah.
Okay, yeah. So let me know when I have to stop the question.
You can increase your volume still a little bit, and you can start anytime now.
Okay. Hello everyone. So this is the trivia time, and the first question is, which are the treatments for type 2 diabetes? A, healthy diet. B, regular physical activity. C, diabetes medicines prescribed by your healthcare provider. D, insulin. E, all of the above.
A, B, and C.
We request you to put the answers in the chat.
I think we have a winner.
We
Yeah,
will have
Vijay.
3, yeah, we will have 3 winners.
We'll have 3 winners, yeah.
For the first question.
But
we have
one
a
per
winner.
question.
Yeah.
And you can only have 1 prize. We should make that clear.
Absolutely. Those who get the prize for the first, not eligible for second and third, and those who get prize for first and second, not eligible for the third question. But they can give the answers, no problem.
Yeah, I think we have a winner, so let's go with it. We have Vijay who answered the correct answer at 11:51. So
Okay, yeah.
We have 3, correct?
no, we have a first person, Vijay, who answered, so he will get the prize, and then we'll move on to question number 2.
Sure.
Congratulations, Vijay. I guess we just need to get his information, right, Rachna?
Yes. So the answer is E, all of the above. So these are all the treatments for type 2 diabetes. Can we go to question number 2?
I think, Rachana, you will explain how to get the prize after third
Yes.
question is taken care.
Yes. Yes.
Okay.
One second.
Yeah,
Who
this
is
question needs to
involved?
be, no, hold on.
Yes.
So this, yeah,
Yeah,
that's me changed.
Yeah. Actually, who is involved in the discovery of insulin? Sir Frederick Banting, Dr. Charles Best, Dr. J.J.R. MacLeod, Dr. James B. Collip, E, all of the above.
Yeah, this question is who is involved
In the
discovering
discovery of
insulin.
insulin. Yeah.
Yeah.
Do we have an answer?
We do, but we're still waiting for the correct answer. Let's proceed. The correct answer is all of the above. They were all, and we got Agni. So let's.
We have a winner.
Yes, we have Agni Shah. So that's a correct answer. All of the people involved in the discovery of insulin.
Yeah, can I just make a comment there? Because people often forget that, people right away think about Banting and Best because the building is named after them. and they were senior. But McLeod and Collip also had a significant influence on the discovery process and the final, process with insulin. So it's all four of them. That's very, very important to remember. It's just not Banting. They're all important, all four of them.
Dr. Prabtani, am I correct that Dr. Charles Best didn't get the Nobel Prize, but Banting and more likely Collip or McLeod got it, correct?
Yeah, because it was, there's so many aspects of this, right? But yeah, Banting did get the senior sort of the prize for all this, right? But Best was acknowledged, but again, there was a little bit of unfairness, which is often in life, right?
Thank you. I know there was a book written about that. So
Yeah. And I encourage everyone. There's
Interesting.
actually a institute in London, Ontario, where the history is given. I encourage all of you, if you get a chance, to go to London, Ontario, and visit the house of insulin.
Yes, the Banting House. The house is called Banting
Yeah.
House. So if you have an opportunity, and if you're a person with diabetes, you actually get to sit on the bed of Dr. Banting.
thank you.
Yeah. So let's proceed on to question 3. And
Question
Agni,
number
you're the
3.
winner. Yeah.
So the third question, which therapies for type 2 diabetes can improve glucose control and have the potential to decrease heart disease independent of glucose control? Okay, my pronunciation may be bad. A, metformin and sitagliptin, Januvia. B, gliclazide, diamicron, and acarbose. C, empagliflozin, Jardiance, and semaglutide, Ozempic. D, there are no therapies like this.
Looks like we have a winner.
Oh.
At Srinivasan. Agni can't win again.
So we wait.
Yes,
winner.
see,
Okay,
Yeah.
yeah. So the
We have a
answer
winner.
is C, empagliflozin, Jardiance, and semaglutide, Ozempic. So I request all the winners to put their email IDs in the chat, and or else you can email us your details to okapresidents@gmail.com. Let me put that in the chat.
then what happens,
Congratulations
Rachana?
to all.
You can send your details for the gifts.
So you will send the gift by email, correct?
Yes, so the gifts will be sent by email. Those are the e-gift cards, and I have posted the email ID there. So I make a note of all the 3 email IDs.
Okay, thank you very much, Rachana.
Thank
Thank you,
you.
Shivas. Thank you, Dr. Prabtani, and all the who took part in the trivia questions. So we'll go to the next item that is called question and answer session. Will be handled by Shiva Swaminathan, who is very familiar to us. She had helped us in organizing seminars, webinars, and especially diabetes cooking demonstration. So over to you, Shiva.
Thank you very much. I'm going to be asking the questions as were shared on the chat, and I'll be going to each speaker. So we have a first question, and this is for Dr. Prabtani. During your presentation, you outlined all the medications, and the question is, are these preventative therapy or are they cure? And then there's a part B, and I'll ask that Dr. Prabtani.
So the question was, these therapies that I talked about, are they preventative? So that's a really good question. So as I mentioned, GLP-1 analogs and SGLT2 inhibitors, they're different therapies, but both of them share in reducing heart disease, heart attacks, strokes, angina. And the ones who benefit the most in terms of preventing disease are the ones who've already had an event. So someone who's already had a heart attack, they'll benefit even more versus someone who hasn't. But that doesn't matter. Even if someone has not had an event, but if they have multiple risk factors such as high blood pressure, cholesterol, they smoke, family history, they'll benefit also. In general, in medicine, most of the people who benefit the most are the ones with the highest risk. Now, they are different. So the GLP-1 analogs have a benefit more on the heart in terms of narrowing of the heart, which can happen in the brain, in the heart, and also in the peripheral circulation. Whereas the SGLT2 inhibitors, they have an effect not only on the heart, but also in decreasing the risk of heart failure, whether you have heart disease, whether you have diabetes or not, as long as you have risk factors, such as having heart failure in the past or having diabetes. And the other benefit that the SGLT2 inhibitors have also is in patients with diabetes or without diabetes who have kidney disease, they'll benefit also from decreasing the risk, further risk of worsening kidney damage and dialysis. So all in all, they have effects on patients who already have the disease, but also if they don't have disease, if they have lots of risk factors beyond glucose control. So we should not just be looking at glucose, we should be looking at the risk of kidney disease and risk of heart disease and using these therapies regardless if they have high risk on top of their usual diabetes therapies.
Thank you so much, Dr. Fartani. We'll come back to the part B, so I just want to get an opportunity to get the other. We'll come back. So the next question is from our dietitian Fatima. Fatima, is low GI rice a replacement for wheat? And the person is trying to go gluten-free. What is your advice, please?
So definitely low GI rice is a better option in terms of the rice, the options of rice available out there. It will probably still be a little bit higher in the GI as compared to whole wheat flour or whole, where the husk is part of it and the germ is part of it in the flour. So whole wheat flour would still be lower in GI than the low GI basmati rice, or there are a couple of brands available out there. But of course, it's much better than the jasmine rice or the short grain rice, or even the basmati rice. Parboiled rice is another option, which is lower GI.
Wonderful. Thank you so much. That's a great question. We'll be going to Shabnam next. Shabnam, how do we handle high fasting sugar in a 16 8-hour intermittent fasting? Shabnam, you're muted.
Sorry. Okay, so it depends on whether are you on medications or not. So adjusting the medications can help with the elevated fasting sugars. Plus, it depends on what are you eating for dinner, how late you are eating. Those things can be sort of looked into and modified, or if you can go for a walk after your last meal, making sure you're well hydrated so your fasting sugars can be better managed. Can't hear you, Siva.
Of course, I forget to unmute myself. Thank you. Thank you so much, Shabnam. We have a question here for Suki. Suki, with the continuous flow monitoring system like a CGM, so like Freestyle Libre are very helpful in monitoring glucose levels, why are they not covered by OHIP?
That's a great question. So Freestyle Libres are actually covered under ODB for individuals over 65 that are on insulin. For instance, the other categories like a Dexcom, which is also a continuous glucose monitor, they do have subscription plans. So and please don't quote me on it. The last I heard was anywhere from $99 to about $150 a month. And for Freestyle Libres, there are compassionate care programs as well that are available. So for anybody over the age of 65, they're covered under ODB if you're on insulin. But again, these products are great, and they unfortunately do come with a cost for our individuals that don't have private insurance, et cetera.
Also, even the private plans are going the ODB way. So if you're not on insulin and you do have private insurance, you still don't get covered because you're not on insulin,
Mhm.
right? Also, there is Dexcom. So Dexcom is now offering like a STI card. So they give you 1 month free supply of Dexcom G6. So
Yes.
yeah, if anybody's interested in that, you should contact your diabetes educator. At least trial it for a month and see what you can learn about how to manage your diet to improve your blood sugars.
And to add on to the last question as well for the individual that asked about high fasting sugars, adding on to what Shabnam had said, if you had a continuous glucose monitor, it could tell us what the trends are, right? So.
Thank you, Suki, and thank you, Shabnam. And as a patient, I'll just add one more line, because as a type 1 and diabetic, I wear a sensor. And one of the greatest things I've ever learned is in terms of food trend, things that I thought were okay. And then with the sensor, I know they're not okay because I can see my blood sugar creeping. So if you're even new to diabetes and you just want to know some of the food you're eating, sensor is a great way at least to test some of the food that you're eating to see the trend. And even if you can't afford, like, try it a couple of times just to see some of the food you're eating and how they trend. That's a great idea. We're going to go to a question for Dr. Praptani. With the first question, we had a follow-up. So the question was, are there any side effects to any of these therapies? And can this be done naturally without these medications? If you could shed some light, Dr. Praptani.
Sure. So with the GLP, I went through that, but I'll go through it again. With the GLP-1 analogs, the most common side effects are GI related. So nausea, some people can get vomiting, diarrhea, constipation. The important thing to minimize the side effects is to go slowly with the dosing. The doctor should not start you at the fullest dose, or the nurse practitioner or the healthcare provider. So go slowly and titrate up slowly. Other things is to eat the more small, frequent meals rather than large meals. Chewing slowly. Some people find that ginger helps with these side effects also, and also probiotics sometimes helps. Of course, staying hydrated is important, and not taking intense amounts of fiber. Fiber is important, but not overdoing it on fiber. If these all things are done in concert all together, we find that the side effects are minimal. And even if you do get side effects, they often get better with time. So I try not to give up on these therapies right away. Try to do a lot of counseling. And Suki will also attest to this in our clinic. We try to, counsel our patients, spend time with them, that if they have side effects, to retry again and on a slower manner. And then, of course, they can get back to us. And there's other measures also that we can try. But those are the main side effects. With the GLP-1 analogs, that's the main thing. There's a rare side effect called pancreatitis, which is very severe. That's severe abdominal pain, severe vomiting. And these patients are sick, they should go to hospital. But again, fortunately, this is very, very rare. And in rats, there was shown to be a form of thyroid cancer called medullary thyroid cancer. Again, we don't use it in these patients if they've had this cancer, but it's, again, a very rare cancer, but I just need to mention it anyways. For the SGLT2 inhibitors, the most common side effect is infections of the genital area, like fungal infections, like we get thrush in our mouth. This can happen in the genital area, more common in women than men. How do you minimize this side effect? Good hygiene, is very, very important. Weight loss, good hygiene is very important. And then there's a rare uncommon risk of urinary infections, which is now much less common than we think. Dehydration, if they're on multiple therapies that cause hydration issues, such as diuretics and things like that. But again, with good counseling and good hydration, this is minimized. And lastly, the most serious side effect is something called euglycemic diabetic ketoacidosis. This is when your sugar is normal, but you get severe nausea, vomiting, abdominal pain with these therapies. And that's when you should go to the hospital. Often it's in the setting of a precipitant, such as an infection or surgery or trauma, or you're not eating. Again, very rare, but again, just to be aware of the side effects. And then if that happens, to go see a doctor right away.
Thank you, doctor. This question is for both dietitians, and perhaps Dr. Praptani can chime in. There are so many diets, and we covered them today, but there's also a diet called carnivore, and the social media keeps touting that animal fat is the way to go, even though that we have talked about keto. They keep talking about fat is not the enemy, but that sugar is. And and there are even many social media, including their metabolic diet they're talking about that's coming through from India. So perhaps the dietitians can shed light in terms of why is carb getting a bad name, but animal fat is not.
You want to take that? Unmute yourself.
Yeah, go ahead.
So even if you just look at basically, you know, from a standpoint, so a carnivorous diet is going to be high in meat, high in fat. We do know from research that animal fat, saturated fat, does have a much higher risk of causing blockages in the arteries and heart attacks and strokes and all that. So media, and I guess there's a lot of, you know, hype about different diets over time. We kind of have to look at the evidence, the scientific evidence, and base it on that. So on looking at a general perspective, we need approximately 50 to 60% of our calories from carbohydrates, 30% from fat. So if you just go by that, definitely we do need some from animal protein if you're not using a plant-based diet, but having a lot more from animal protein is going to increase your caloric intake from saturated fat. That's going to push up your bad cholesterol, your triglycerides, your bad cholesterol, LDL, your total cholesterol, and that's going to increase your risk of cardiovascular diseases. However, on the carbohydrate side, we have to remember that there are good carbohydrates and bad carbohydrates, and that's not a term that I should be using. There are carbohydrates which are higher in fiber, lower in the glycemic index, which help our body much more than the carbohydrates that are devoid of fiber, and that causes our blood sugars to go up and increases other issues. So it's a balance that we have to keep. We cannot get rid of carbohydrates from our diet and do just an animal-based, protein-based, carnivorous diet. It's very hard on the body in terms of the cholesterol, and it increases the risk substantially of coronary artery disease. Shabnam and Dr. Prattani, do you have?
So we go by the Diabetes Canada guidelines. So the guideline states that we have to make sure that the diet is high in fiber, low in saturated fats, because those make us insulin resistant. However, I know online, and we have Dr. Jason Fung, who advocates a lot for the keto diets or high fat diets, saying that it's not the saturated fat is not increased by eating those products, but actually it's the carb intake which makes your your saturated fat go high. So honestly, it's a very controversial topic right now. And based on what I recently heard from him, there are some cardiologists who have looked at the evidence, and they are actually saying, as per Dr. Fung, that it's the carbs which are the problem. So for me, I say that just follow the plate method of eating and go low carb if you want. There are lots of low carb options available. I'm not sure if you all know that there is this Carbonaut bread that you get in Costco. It has got only 2 grams of available carbohydrate. It is very high in fiber and a good source of protein as well. There is the Power Slice bread, which is even higher in protein, and it's got only 1 gram of available carbohydrate. So try those options so that, you know, you don't go extreme any one way. Go for moderation. So there is Oro wheat wraps which are available. So instead of roti, you can buy those wraps and use those if you like, you know. So some of these products are available in Costco and some other supermarkets. So try them. Yeah.
Thank you, Shabnam. And Dr.
just have a-
Prattani, yes.
Yeah, I agree. You know, I think anything in moderation is okay. If we look back hundreds and thousands of years ago, our forefathers lived long because they were active, they were eating healthy foods, and they were eating less processed foods. I think if we follow the same principle, and moderation will be fine. And the plate method is actually quite good. You know, like, lots of vegetables and fruits and meat and alternatives, plant-based or not. As long as there's a balance, I think that's important. we have all these products at Costco, but some of them are expensive, right? It can't meet the needs of everyone, especially in the economical status right now. There's a lot of poverty and homelessness and stuff. So I think we have to be careful. I think we have to make changes at home. Like if we're using white flour at home, we should shift to whole wheat. If we're using jasmine rice, we should switch to parboiled or sella. These things aren't that different in price. I'm not a grand cook or anything like that, but these are some simple measures, and see what you can comment if I make sense from a practical point of view. So cost is important, home practicality is important, and really important to eat at home as much as possible. I do like eating outside, but I think we have to balance. I think on the weekends is fine, but generally speaking, we should be eating at home because we know what we're putting in our food, right? We know exactly what we're doing, and our kids will learn from that also. So these are important things. So moderation is important, taking into consideration cost. And a lot of these foods, I don't know, Shabnam, I do buy some of that Costco bread, but it's not the tastiest bread, and
I like the
my bread.
carbonara bread. I
You
like
like it?
carbonara
Yeah.
bread. Yeah, it's good.
Yeah, I
Adding
gotta
to
put
your
some butter
point-
on it or peanut butter on it.
Yeah.
Adding to your point, Dr. Pratavni, of using like the whole wheat flour, I sometimes I ask my patients to do a mix of flours. So barley flour is one which is high in fiber, and soya flour and kala chana, not besan, but kala chana atta. Those are a little bit higher in protein. So if you combine the 3 or 4 flours together, then it gives a
Yeah.
nice mix, and the roti is softer because there's more protein, but there's more fiber from the barley as well. So whole wheat, barley, kala chana, and soya flour, those are the ones that I mix, but whole wheat a little more than the other 3. And then the roti comes out nice.
Well,
I
sometimes
just,
people are looking for a ready-made option. So that's why I like to
Yeah.
share that with my patients.
Yeah.
People don't
Yeah.
have time to make roti and all like we used to back home. So everybody's situation is different. So this option is also there if y'all want to, go for it.
I'll
If
just
I may-
share, I'll just share what one point is that we want to keep it to a structure. So one of the king things that I had found as a patient, again, wearing a sensory, is my nurse had told me sometimes when we do a takeout food or restaurant food, you have to treat this almost like a fast food. It takes 8 hours sometimes for my blood glucose to normalize. I'm a type 1 diabetic, and I take insulin. So not every food is, same. You might be cooking your wonderful food at home. You use less fat and sugar and whatever you do. But outside food has a lot of additives. So you be really mindful of that. I want to jump to a question to Dr. Pratavni. In terms of losing weight, if you've lost a lot of weight in a year, is there any clear indication that there's some issue that could I be having a pre-diabetes condition? This is a question from the floor. Thank you.
Yeah. So, weight loss can be due to many, many things, right? It's diabetes is one of them. Uncontrolled diabetes. It's not mild diabetes. It's usually uncontrolled. The sugars are in their teens, and they're urinating a lot and thirsty a lot. But again, if you have so the question is it intentional weight loss or unintentional weight loss? If it's unintentional weight loss, we take that more seriously. Then we have to see our doctor. Doctor's got to take a history and a physical and determine whether this is an endocrine cause. It could be thyroid disease. It could be diabetes. It could be adrenal insufficiency. It could be depression. It could be a cancer. It could be a GI issue like an ulcer or a tumor. It could be many, many, many things. Okay. So this is where you need to see your doctor to figure out why the weight loss is going on. And based on that, after the history and physical, your doctor or healthcare provider may do some tests, blood counts and your glucose and your thyroid, and maybe even some imaging if there's a concern about cancer, colonoscopy, for example. But it all depends on the history and the physical. We just don't do all these tests without doing a history and physical, because otherwise we're in a resource limited situation now, and we're going to waste a lot of money and cause a lot of anxiety to our patients. So the first thing is to see your doctor to find out what the cause is based on history and physical, doing some simple blood tests, then taking it further to see if you need to see a specialist or not for these things.
Thank you, Dr. Pratavni. Suki, I'm sorry, I cut you out when we were discussing in terms of the popular diets. Did you want to add something, Suki?
Yes, thank you, Siva. I just wanted to emphasize on the importance of, if you as an individual are planning to include more fiber and less carbs, just be mindful if you're taking insulin or other medications, when you're switching your diets completely, it might cause low blood sugar. So consult with, your healthcare providers, endocrinologists, and educators before you do that. you,
Excellent point, Suki. Absolutely, I agree. We have a combined question for both of our dietitians. This is just a general question about eggs. Are eggs truly beneficial for diabetes? Are they, is there a best alternative to eggs? Could both dietitians chime in on that, please?
Okay,
So
so yeah, go ahead. Shabnam.
You go ahead, Fatma.
All right. Okay. So in terms of protein, eggs are a good source of protein. They're a solid protein. They are a protein where there's no carbohydrate with it. So it's a pure protein. So that's why they are a good choice for protein. However, it doesn't mean that is the only choice. There are multiple other choices out there. If you're a vegetarian, you can do tofu, you can do soya protein, soya nuggets, you can do paneer, you can do cheese if you have dairy in there. So there are alternatives to it, definitely. Greek yogurt is a good choice as well. It does have some carbohydrate with it, but much more protein. So that's a very good choice as well. So there are alternatives. It's not that if you don't eat eggs, you have to eat eggs. No, but if it's something that you're looking at that I do eat eggs, is that a good choice? Absolutely, it is for a good choice of protein.
Thank you, Fatima. And Shabnam, do you want to add anything?
Yeah, so instead of egg, if you want to use tofu, as Fatma mentioned, you can just crumble the tofu and make like how you would make scrambled eggs with, all your spices and vegetables. You can use tofu, do the same, and it actually tastes just like you're eating a scrambled egg. So try that out.
I love tofu scramble. We have a last question for Dr. Pratani. Questions all the time about alternative therapy comes up. So the question is, could like a Ayurvedic diet or naturopathic diet, or could they complement medicines that you had talked about?
So I'm not an expert in those areas, but my simple answer to the question is stick to what we've been doing for a long time where there's evidence, and just be cautious. That's what I would suggest on these diets. It should not replace what's recommended based on evidence and best practice, but as long as it's done in moderation and there's no side effects, I'm not opposed to it. But keep in mind, a lot of these things are based without evidence, and they're based on anecdotes and tradition, and they may have side effects, and you may be spending a lot of unnecessary money. I have patients who bring in like 20 vitamins, vitamin A, B, C, D, E, F, G, but we're getting this in our food. So why are you spending this extra money? It doesn't make sense. If you eat healthy, you don't need these vitamins. You're wasting your money. And they're marketed so well, right? The marketing, you go to Costco, you have a whole big aisle of vitamins, but most of those things, if you eat healthy, you don't need them. And correct me if I'm wrong. Hopefully I'm right. Shabnam and Fatima will comment on that. So that's my answer to that question. I just have a question if you want to respond to that, Fatima and Shabnam.
So no, definitely, absolutely, you're right. Most of these vitamins we get adequately in our diet if we eat healthy, and we don't need them as a supplement. The supplement that we generally recommend is the vitamin D because of the lack of sunlight, especially over the winter months. But that's the only supplement that we recommend. Other than that, everything you can get in your diet. B12 for vegetarians, but nothing other than that.
Yeah. So Shabnam,
so if you're eating
Fatima,
a balanced diet, means making sure you're including a variety of foods in your diet. All food groups are part of your daily intake, because I know some people only focus on eating carbs and some protein. They don't want to have vegetables. So in that case, your diet is not complete. It's not balanced. So when we say balanced diet, what does that mean? It means you're including all the different food groups.
Yeah. And it can be feasible, right? Yeah, the method with lots of different colors, right? Colors are very important.
Yes,
vegetables.
absolutely.
Yeah. I keep it simple. I just tell patients to use the plate method. I'm not a dietitian, but lots of colors. Have some milk in there, right? And of course, culturally sensitive. If they don't eat meat, then go to the plant-based stuff, right? My question is that a lot of us are very busy. We were active and we're exercising. Can you comment on protein shakes and whey protein as part of a protein source, especially the bottled protein shakes, which Costco again displays very well, and they sell out very quickly.
And the Boost and things like that. That's
Supplements.
sponsored by. Yes.
Shabnam, you want to take that first? Go ahead.
Well, there's a place for protein supplements for certain populations. Like if I have a patient who's on a, he's not eating well and he can only take liquid supplements, then yes, certainly those protein supplements are useful. But generally, if your diet is like we talked about it, that you're having a balanced diet, I don't see why you need to take these protein shakes. Some people who are trying to bulk up and build muscle, well, and if they're not getting adequate through their diet, then they may opt for that option. But try to focus on your diet because it's more wholesome and it's giving you all the nutrients and not those extra chemicals or preservatives that you would get from a ready-made supplement. Fatima, you can add.
I agree. Seniors may have a little bit of place where they're not able to maintain a healthy diet or not adequate, then I would maybe say supplement with, diabetic boost or something like that. But generally, I agree with Shabnam. I usually don't recommend anything as a supplement, like the protein shakes and all that.
And
Balanced diet, focused on that.
And lastly, I'll just say again, from a patient's perspective, there are just there's not even natural things in it. There are just a lot of added chemicals.
Chemicals,
and if you look at the ingredients, so stay away from them. And like they all talked about, eat the real food, the source, the whole foods. I want to thank all the presenters for today's informative, incredible presentations, and I'm going to hand it over to Sadanand to say last few words for today's event.
Thank you, Shiva. They were excellent questions, lots of added information. Really thank all those who asked the questions, and thank you, Shiva, for conducting this QA session. Thank you. As I had mentioned in the beginning, this event was organized under the umbrella of OCA, SVBF, South Asian Diabetes Chapter, as well as Diabetes Canada. So I would like to give a couple of minutes each of the representatives, starting with Shiva for Canada, Diabetes Canada and South Asian Diabetes Chapter, please.
Well, again, thank you very much for having this. And November is Diabetes Awareness Month. So we're really, really happy to bring this informative sessions. I mean, I was blown away at every presentation, the information. I hope people will make use of it. And, we're hoping that more people will tune in the future, because I know this is being televised and, this is being recorded. But hopefully people will listen and learn from a lot of these informative meetings. And again, thank you for the organizers for having us.
Thank you, Shiva. Tell you the truth, there are more requests for YouTube and slides than those who attended. It's quite interesting. I think there is an advantage and disadvantage of virtual things and YouTube. People will wait to see it or listen to it later. But anyway, let's see what happens. Next, it really gives me great pleasure in introducing Dr. Param Bhatt, the trustee of SVBF. Param.
Thanks very much, Sadanand. First of all, thanks very much for all the presenters. I think in the last hour and a half, we had more than $1 million worth of information here. I can't believe you experts spent the whole morning with us, educating us on these important aspects. So all the presenters, thanks very much. We really, really appreciate it. And special thanks to Sadanand, Rachana and Shiva for organizing these seminars. We hope we'll keep doing this, many more of such things, but somehow we really may have to make an effort to get more people come and watch live rather than wait for a YouTube thing. So anyway, so once again, thanks everyone. Have a good rest of the day.
Thank you, Param. Really appreciate your continued support, especially SVBF, without which we couldn't have done all these things. Thank you. And next is OCA President and our backbone, the technical support, Rachana Kamath.
Thank you, Sadanand ma'am. First of all, thanks to all the presenters. It was a very great session. I used to attend sessions right from pandemic. So then I realized that technical support is very important. And that's when I said, Sadanand ma'am, like, you do any session, no matter what, technically we will support you. This year being 35th year of Konkani Association, I took up the president. So being president and technical support, I mean, we are doing both the things for Sadanand Ma, and we will continue to support. Also, special thanks to Param Uncle for always helping us. SVBF and OCA together, we organize a lot of such health sessions that is helping the community, and we are proud and feeling privileged that we are able to give back to the community with the help of all you speakers. Thank you so very much for educating us. Thank you.
I just wanted to say one last thing, Sunil. I know between the break, we had the evaluation on the screen.
Yes.
It is really important for everybody who attended this, or you could email it to them, that they give feedback, because feedbacks are really important for us in terms of organizing for future and for the speakers as well. Thank you.
I think we can do one thing. We can send out the YouTube links and
Yeah.
the feedback form links so that people can watch session and give the feedbacks too.
Great. I think that we can do, because we will have to send the YouTube recording also, so we can do it at the same time. I'm sure that people who didn't attend will get it, but still it doesn't matter. So, okay, once again, thank you everyone for the continued support. We started thinking about this about 6 months back, and tell you the truth, it's Shiva who initiated it. And this being the November being the diabetes month, it makes a lot of sense. Yeah, ours was not the first one, but maybe the one of the last one to hold in the month of November. All the speakers really admire your time. I know that you are all busy, and that too coming on Sunday. It is extra work. Thank you all. And those who attended, thank you. Please share the information with your friends and family so that they can come and attend our future sessions. Once again, thank you all. Have a great Sunday. Have a great winter. Bye for now.
Thank you all, everybody. Have a
Yeah.
fine Sunday.
I'll
Bye-bye.
just end the